half of Americans say that they'll get a coronavirus vaccine when we have one. That's according to a new NBC News poll. 44% of American adults say they'll get the vaccine, 32% say they're not sure, and 22% say they won't get it at all. Dr. Richard Besser joins me now. Dr. Besser is the former acting CDC director and the president and CEO of the Robert Wood Johnson Foundation, and we are always thrilled to have him on the show. Dr. Besser, according to that poll, just 44% of Americans are sure they will get the vaccine. How concerning is that stat to you, and what kind of numbers would you ideally like to see here?
Well, it's very concerning, and I think, Allison, what it comes down to is trust. What you'd really like to see is very high demand, that everyone in America is waiting on there being a safe and effective vaccine because they know that could really turn this around. But there's a lot of issues of trust going on. There's a lot of concern that the process has been politicized, concern that corners could be cut in terms of safety testing, effectiveness testing. And so it's going to take a lot of work breaking down by different racial and ethnic groups so that you can understand what are the concerns and how do you address them. And that takes a lot of time, a lot of effort, a lot of energy.
Dr. Besser, this week the World Health Organization said that young people are now driving the spread of this virus. What exactly is going on according to the WHO?
Well, it's true that young people have a different course of COVID in general than older people. There's a lower risk of hospitalization, lower risk of death. It doesn't mean that young people can't get very sick. Many will get hospitalized, but most won't. What we don't know, though, is whether in the long run there's going to be long-term side effects from this. And so I worry when you hear about young people treating this very cavalierly. What we're seeing is the need of young people to socialize. It's very hard to stay in isolation, to stay in quarantine, to stay away for anybody, but in particular for adolescents, young adults, young people who don't see this as that much of a threat. The big concern, though, is that young people don't just stay with young people. You know, they interact with older people at home. They may interact with people who are workers who may have be at a greater risk of severe disease. And this, as we've seen in Texas and California and Florida, has driven some large increases around the country. You know, a lot of these numbers are starting to come down. So hopefully that means that people are getting the idea and are starting to do those things, wearing masks and social distancing and hand washing that work. But the word that's been coming out from colleges and universities that plays into this is very worrisome, because young people at colleges and universities won't just infect each other. They put staff at greater risk. A lot of staff are people of color, and we've been hearing more and more reports again about Black and Latino Americans getting hit much harder. What young people do really matters to the population in general.
Dr. Besser, let's talk a bit more about colleges, universities, schools. UNC Chapel Hill has said it's transitioning from in-person classes to online classes because of an outbreak there. How can students go back to college or to school and not get sick? Is that possible?
Yeah, Allison, it is really challenging. You know, I can envision it working in areas where community transmission has been driven to very low levels. But even in those situations, what you're going to see is that they're going to be small outbreaks and clusters. And if you're able to do adequate testing, if you're able to isolate and quarantine, if you've decreased the number of students so that there can be social distancing on campus, and if you can find that magic way in to change the behavior of young people so that they're willing to socially distance, then you may be able to have some effect here. But this is happening at the same time that, you know, K through 12 schools are opening, and there's more and more opportunity for transmission. And again, the greatest risk on those campuses isn't to the students, it's to the faculty and it's to the staff, and staff in particular who don't have the choice of working remotely.
Dr. Besser, you always have such great advice for us and are always so helpful as we try to better understand the coronavirus and what it means for especially young people as they're going back to school. Thanks for coming on again.
Thank you, Allison. Great to be here.
It's primary day in South Florida. Voters there are dealing with the pandemic as they head to the polls. NBC News correspondent Carrie Sanders joining us now from Miami Beach. Carrie, what's turnout like there today? Are people heading out, or did they take advantage of mail-in and early voting?
Well, it's really interesting. We're seeing a trickle of voters. It's a primary election in the state, so you don't normally have a whole lot of turnout, but it feels like we're seeing less. And when we go to the numbers, you can determine that people who are dedicated to voting in all elections have in many ways turned towards mail-in voting. It's something that's been in Florida for a while, but we have so far in the mail-in votes that have already been collected 2.2 million. To compare that, go back 4 years pre-coronavirus in a primary election, about 1.3 million people. Now, on top of that, Allison, there are still more than 2 million mail-in votes that were sent out. That doesn't mean that everybody's going to necessarily participate, but it will give us an idea of those people who do decide to participate with the mail-in vote, sending them in, but sending them in either late or sending them in so delayed by the mail service that their votes don't count. So we'll be monitoring that over the coming days to see what percentage of those mail-in votes never made it by the 7 p.m. deadline of today's election. Allison?
Carrie, for folks who are coming out today to vote, what is Miami-Dade County doing to make sure that they're safe?
Well, just about every election office in the state, including here in Miami-Dade, is making sure that people are socially distanced. As I said, it's a trickle of voters, so we don't really have lines of people. They've provided hand sanitizer, giving people the space that they need in there so that they don't feel threatened. The voters that I've spoken to who've gone in and out have told me that they chose to vote in person, one, because they didn't trust necessarily the U.S. Postal Service to get their vote there, but also because they feel it is something that they want to participate in, not sitting at home at the kitchen table getting a pen out and filling it in, but rather going through the process, walking in, being part of democracy in sort of an active way where they come out and vote. And again, I think a lot of this is going to be kind of a crystal ball in a very small way of what we're going to see in the presidential election, Allison.
Absolutely. Carrie, also today, a felony rights case in federal court. Get us up to speed on that. What happened today?
Well, Florida voted with an amendment on the Constitution here that would restore voting rights for convicted felons. So you served your time for whatever crime you committed, you're out, and the amendment passed that you would then be able to get your voting rights back without going to the state cabinet and petitioning. You would just get it back. But included in the amendment was the language that has now been the big debate that winds up in court. Does the felon, who is now free, does he have to make all court costs and restitution for the crime that he or she committed? The problem with that is especially court costs are not tracked in the state. So felons who have wanted to get their voting rights back have tried, in many cases, to pay by going to the court and saying, how much money do I owe? The clerk of the courts can't tell them, and so effectively they feel that they're being barred from voting. The state says the language is clear, you have to pay before you can vote, but those who are representing what are essentially 750,000 felons, ex-felons, who could then potentially vote again, those 750,000, they're arguing having to pay to then vote, that goes back in history to the Jim Crow times of a poll tax, and that is not acceptable, and we know that. So the appeals court now has listened to this again. Now it's the full appeals court, but a decision from them is not on any sort of timetable. Of course, those representing the felons who want the right to vote again, those lawyers are hoping that a decision is made by the appeals court before the November election. But again, no timetable on this, Allison.
Well, we are talking about a significant number of voters there. Carrie Sanders in South Florida, thank you so much. The NBA making it to the playoffs without a single coronavirus case inside the Disney World bubble. The league says that it's testing 1,300 players, coaches, and staff every single day. NBC News correspondent Sam Brock reports.
Allison, good afternoon. Under ordinary circumstances, the Miami Heat and its fans would be getting ready to host playoff games here in Miami. Instead, this basketball team and 15 others are 200 miles away in Lake Buena Vista, Florida. That's at Disney World inside of a bubble, and that is where the Miami Heat are going to be squaring off against the Indiana Pacers tonight. 16 teams are there right now. What they have sacrificed in fan atmosphere, they've gained in the ability to host a postseason. Pretty remarkable. The NBA says they have tested about 1,300 players, coaches, and staff members every single day since the middle of July when everyone arrived. They have had 0 positive cases of COVID-19. Certainly they're trying to keep it that way. They're going to get a bit of a challenge here coming up after the first round of the playoffs. That's when each player is allowed to bring up to 4 family members or close friends into the bubble. They also have to self-quarantine for a week in their homes and then quarantine for a week in the bubble. And they get tested every single day in quarantine as well. So tons of precautions coming at a time, Allison, when the state of Florida is doing better with COVID-19 and transmission. At least that's what the numbers suggest. The positivity rate for the state has now dipped below 8% for 6 times now, 6 days in a row. It's been under 10%. Remarkable improvement for this state, but also less testing going on. There was 39,000 tests reported on Monday, 56,000 tests reported today. Florida was around 100 to 120,000 tests for weeks. So that's come back down, but so was the transmission rate. Hospitalizations, which in Miami-Dade were at about 2,000 a couple weeks ago, are now at 1,300. So all of these trend lines are moving, generally speaking, in the right direction at a time right now when Florida is trying to fight its way through, not just to be able to open things back up, but to send kids back to school, with debates ongoing about whether or not these are the safe conditions to do so. I would add in final here that there is a mediation going on right now as we speak between the Florida Education Association and the state of Florida over whether or not they can force schools to reopen in-person instruction with COVID-19 still as prevalent as it is. It's the latest here in Miami. Sam Brock, NBC News.
Hey, NBC News fans, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.